Well, we're not going to keep prolonging this thing for hours or days, but when's the best time? So we work together with the families in that so that there's no rush. They don't want to get the appearance that we're like vultures here in the hospital. Okay, that's over with, and no feeling, no compassion. But nor do we just keep dragging things out for the patient's sake, because this is what the patient wants. So a lot of this goes back to patient rights, what they wanted, what they wished, in the right tact and timing. How do we support the family in this? There's all kind of emotional needs that are going on. We talked about the styles of grieving. There are moments of saying their last goodbyes. As we're approaching that time of removing life support, and the patient is in this certain room and the families all gathered together, I encourage the family members maybe even go in there separately, one by one, and say their last goodbye. There are those kind of I'm sorry's and forgive me and Dad, Mom, I'd like to, whatever, that need to be said privately. They will say individually, I don't need to, and one goes, oh, yeah, I need to. So let's say at 4 p.m. we're going to remove life support. And here it is 3 o'clock. We're going to go in and say our prayer together. We've called in the priest appropriately, the ministers appropriately. Everybody's there who needs to be there. And you say to the family, would you like to go in now and talk to them, say a prayer, spend a little time with them? If they say no, 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 then okay, at 4 o'clock this afternoon, we're going to remove life support. So they've got that. So if you don't somehow prepare there, it's like, I wish I had that time together. No one offered it to me. No one thought of that. So again, you as the minister working with the medical team, there may be the respiratory therapist standing there, I'm ready to remove the ventilator when you are. There may be the nurse going, I'm ready to stop these IVs when you are. I'm ready to stop this dialysis. Whatever needs to be stopped, I'm ready to, but you as the minister may hear different things that would be appropriate. Go, well, not quite right now. After this and this is done, then that's appropriate. So you could be that go-between of them. Family support. At times there are medical errors, there are misdiagnoses, there are questions to the doctor. Sometimes those things need to be solved, sometimes they need to be talked about. There are times when I, as a patient representative, would get with the nurse or the doctor and sit down with the family, open the charts and go through the issues. Here's the truth, here's what happened. And then they're able to go, oh. Or I say, I want you to go find the smartest doctor you know, the smartest nurse you know, the smartest respiratory therapist you know. I want you to call them into this meeting and help ask questions for you. You're not medically trained, they are. I want you to get at ease with this. Something went wrong and you need answers to it. Because see, I hear people 20 years, 30 years later going, well, why didn't they do this? Why didn't they do that? That could be solved in a 30-minute meeting rather than prolonged. And then it's that bad hospital and that bad doctor and that bad nurse and that bad institution. Just the whole place is bad, because they're looking at one little issue that never got answers to. So sometimes in that talk, you may say, you need to ask some questions. You need to talk to somebody. May I call a risk manager for you? May we get sitting with the doctor for you? What do you need to solve this issue so that you can move along? Some of those angers last for a lifetime that never get solved unless we do. Family support. Ethical questions they may have, of misunderstandings, miscommunications, disagreements. Again, the ethical ad hoc meetings are available for them. Spiritual questions. Why God? Why me? Why now? Why not till after their birthday? Why not till after Christmas? And then they'll ask, well, why not this year? There's questions that they'll be asking in your presence. And guess what? You don't have answers for it. So our purpose is not to give an answer. Our purpose is to sit there with 2 ears and a closed mouth and listen. Sometimes we have little answers. There's another seminar I'll do one day of the 50 different bad answers that I've heard. That awful, that we say all the time. Things that we go, well, I've just got to say something, well, God must have wanted them up there. Did he? Is that really why they're up there? You know, or, you know, they're a little angel now, or something. All these little sayings that we somehow want to fix it. So we say something that I sometimes think we say something worse. That if we just were to sit there and let them vent, they would get done and go, thanks for hearing me. Thanks for letting me talk. There's questions about miracles. They know miracles work one day, one person, one situation. Why not here? Why did this person die young? You know, why death? Why sickness? Why does God allow that? And you as a minister have heard those often. You've heard books read about why do bad things happen to good people. You know, all these things. Nobody really has a great answer for it. But there will be a lot of questions out there. About eternity. Did this person go to heaven or hell? Did this person meet their maker? Did this person make it right with God? This person that went into a coma, did they make their last decision? Don't know. You know, maybe if we could have prayed, or sometime it's, can we wait one more day? Maybe they'll come out of this coma and then make a decision. Some spiritual decision. And there many times we have halted removal of life support just for that wait. Not very long, but for the courtesy of some kind of miracle to happen. Then some last prayers for with the family, including some of those questions and those things that we just don't have answers for. Let's talk a little bit about hospice care. I'm so encouraging about hospice. I think some people think I get some out of commission for it. Hospice is an excellent agency that does a wonderful work with families and work with the patients with a very, and of course they have a lot of chaplains too that work with their program, so we're kind of working together with that. The way they do that is being able, what I'm teaching you, is sit down with the families and listen to that need. They take the time to do that. I feel so sorry for hospital staff that are very spiritual people, very loving people, very compassionate people who go, I just don't have the time. I wish I could sit by the bedside. I wish I could talk more. I wish I could be present a little more, but I can't. Let's call in a chaplain to do that. And then it will relieve me as a worker in the hospital that somebody sat down with them and dealt with that. So that's a lot of what hospice does. They spend time with the families, they spend time with the patient, trying to listen. They're trying to alleviate pain. They know death is imminent, death is going to come. We're not going to prevent that. We're not going to try to fix it any longer. You might even notice that some hospice patients get better, quote unquote. Think of the situation of a person that has been treatment after treatment after treatment, and they've been in pain, and they had all kind of discomfort, and then when they finally go, okay, no more sticking, no more poking, no more prodding, no more procedures, no more surgery, just keep me comfortable. And before that point, they were in such awful pain that they didn't feel like eating. And sometimes some of the medications you take don't make you want to eat. So they couldn't eat, and they lost weight, and they lost strength, and then they couldn't even stand beside the bed, and then they were bedridden. And then they go in hospice, and they give them something to take care of the pain, and a few days later they go, I feel like eating a little bit. And then I feel like eating a little more. Let me see if I can stand on the side of my bed. Wow! And then walk a few steps, and the family's going, they're better! You know, it's like, well, not really. I mean, you know, the cancer's not gone, or the heart problem's not gone, or the lung problem's not gone, but they're rallying, okay? Let's call it that. So, and some patients can get so much better, they're excused from hospice care. They're like, well, it doesn't look like they're going to meet the criteria anymore. Well, they'll be back, but for right now, they do better. For some patients, that's just what they needed. Somebody to listen to me, somebody to quit trying to fix it, somebody to just kind of cut the pain, and then they're stronger for that short period of time. So you might see that in your care of patients, that they do a lot of counseling, a lot of listening. Withdrawal of life support procedure. Let's say it's time for you to go in, and at 4 o'clock we're going to remove life support. You have a prayer, you have a